So Chris, what are you going to do with this horse?
So this horse is a 3-year-old thoroughbred. It's got a left-sided sinusitis. It's got a fractured 210 cheek tooth. We're going to extract the 210 cheek tooth, then we're going to make a little sinuscopic portal in here. We're going to flush out all the pus from its nose, from its sinuses, and clean it all out.
Okay, and as a specialist, why would you not do that in a stable?
Why would we not do that in a stable? Yes, well, that's a good question. I actually had an email from a vet today saying that she'd recommended her horse to come here, but at another local practice had said that they have a specialist who is geared up for doing advanced procedures in a stable, and so they've decided to go down that option instead. I've just done a nerve block on this. We're just waiting for him to be a little bit more sedated, so I'll just explain a few reasons why we don't do that if we can possibly avoid it. The first thing is dental procedures have historically a relatively high complication rate, and in order to avoid those complications, you need to stack everything in your favour. Now, we have very low complication rates with our procedures, fortunately. We're usually pretty quick, pretty fast at doing extractions, and we have everything here ready for any plan B or plan C or plan D that might be needed. But it's not just that. The value of the equipment is very high, so we've probably got between 150 and 200,000 pounds worth of equipment in this room, which you can see stacked up on the floor here, which we take out when we go and visit other clinics with x-ray machines, ultrasound scanners, flexible endoscopes for looking up the nose, sinoscopy instruments, surgical instruments, extraction instruments, oroscopic examination instruments. So there's a lot of very expensive equipment, and again, none of that is really ideally situated or ideally designed for use in a stable. We are geared up for working in a stable. I could easily work in a stable, but it is not the best environment for that kind of expensive equipment, and more importantly, for the horse to be in. So today the temperature outside is about 5 degrees, and we're in a lovely temperature controlled environment here in the clinic. It's about 18, 19 degrees in here. And horses don't do well when they are in a very cold environment for any significant amount of time when they are sedated. We've also got stocks, which means that the horse is very stable and secure when it's under the amount of sedation needed for these types of procedures. We've got a flat, level, rubberized floor, which is very safe. We've got lots of space to the side should anything happen and we needed to remove the horse from the stocks in a hurry. Again, all of these possible problems are very rare, but when they do happen, or if they do happen, you want to be in the best environment possible. And when we come to do our examination, we really want to visualize what we're doing in the best possible way. So I'm just going to show you what that means. So he's nicely sedated now, so I'm going to pop this gag on, and we're just going to have a quick look in the mouth just to see what we've got in here and what we're dealing with, and you'll see another reason why it's so nice and it's such a good experience for the owners as well, and it's such a nice place for us to work and for the horse to be when we're doing these procedures. So I'm going to use my digital oroscope here, and you can see that we've got this big image on the wall. So when we look back, we can see the fracture of the tooth here. So this is a long way back, this tooth. It's the 210. It's a very big tooth. It's fractured. It's got root disease, and that needs to be extracted. It's already fractured, so there's a chance it could fracture further, meaning that we'll have to do a transbuccal surgical procedure in order to extract it. And if I do have to do that, again, having good visualization is so important. And there's just no way you can have the same level of visualization and the same level of sort of comfort and security for the horse, for the surgeon, for the owner, and for everybody when you're in a stable environment. It's just not possible to have the same kind of degree of standards when you're working. So that's pretty much mostly the reasons. And I think it comes down to clinical standards. We want to provide the very best service for our clients. That's what they want. That's what they expect. And as soon as you start saying, well, yeah, I'm a specialist, but I'm going to work in a stable, that is immediately lowering the standards, and it's going to increase the risks of infection. It's going to increase the risk of things going wrong if anything started to go wrong, because you're just not in the right environment. It's not the safest thing, it's not the best thing for the horse. So I hope that's answered the question, but overall, we want to do the best standard of care we can for our patients. Our clients expect that, and above all, it's safest and best interest of the horse.